Thank you for that wonderful, warm introduction. And I would like to thank the principal, Juju George Baby, and the head of the Department of Oral Pathology, Dr. Deepu George Matthew, Annur Dental College, Muatupura, for giving me this opportunity to present my topic on this rapid review for undergraduates. So we move on to my topic. The topic of my presentation is salivary glands. So the contents of my topic are introduction, a classification of the salivary gland, structure and histology, composition and functions of saliva, the innervation part, and the clinical consideration. So moving on to the salivary gland, we have, as you can see in this picture, there are three major salivary glands. The arrows points to that. You all know the major salivary gland, that is the parotid, the submandibular, and sublingual. These are compound exocrine glands that secretes saliva. Exocrine means you all know that it is made up of ducts. So these are compound glands with more than one tubule entering the main duct. And the structure is, it has a tubular part and an acinar part, means the ductal system as well as the secretory units called acini. And these acini are the secretory units of the salivary gland. Classification of salivary gland. Based on the location, they are classified into major and minor salivary gland. The major ones are large in size. They are extraoral, situated extraorally with a ductal system that opens intraorally. You all know the major salivary glands are the parotid, submandibular, and sublingual. The minor salivary gland, they are smaller in size. They are present intraoral only. They have short ducts and they are numerous in number. They are mostly seen on the buccal mucosa, the labial mucosa, the palatine region, and of course, the lingual surface means the dorsal surface of the tongue. And based on the nature of secretion, the salivary gland, the saliva can be divided into serous secretion and mucinous secretion or mucus secretion. So coming to the major salivary glands. So we all know they are the parotid glands, which are serous in nature. You can see it in the picture, the parotid gland near the external ear. They are serous in nature. The secretion is serous in nature. They have the major duct called as the Stenson's duct. Now something on the Stenson duct. They cross the masseter muscle and they cross this masseter muscle and turn medially into the penetrating into the buccinator muscle. And these are the two muscles that they cross and they open into the intraorally at the buccal mucosa opposite to the second molar region. So that is Stenson's duct for you. And coming to the submandibular gland, okay, they are present above the mylohyoid muscle and the secretions are mixed in nature. Means it contains both serous as well as mucinous component. And they have the duct called as the Wharton's duct. It opens into the sublingual papillae at the floor of the mouth, lateral to the lingual frenum. And the last duct, major duct, is the sublingual gland, which is the smallest of all the three, as you can see from this picture. And the secretion is mixed in nature. And they are predominantly mucus. Okay. And they have the major duct. The major duct can be seen here as I show in the arrow. They are called as the Bartholin's duct. They open near the submandibular gland duct itself, near the lingual frenum, lingual papilla. And there are some more smaller ducts called as the duct of Ravenous. They have direct opening into the oral cavity. So that is about the major salivary glands. Coming to the minor salivary glands. They are numerous in nature. I told you they are numerous in nature. About 600 to 1,000 glands are there in the oral cavity, and they have a diffuse spread throughout the oral cavity. Mostly they are aggregated in the submucosa. Now, what do you mean by the submucosa? As you can see in this picture, you have the epithelium and the lamina propria, means the connective tissue. Inside the connective tissue, this area is called as the submucosal, means just adjacent to the mucosa. We have the small glands called as a minor salivary gland. Except for the gingiva and hard palate, there will be glands throughout the oral cavity. They won't be seen in the gingiva and hard palate. And most of this minor salivary glands have mucinous secretions, except for a gland, the minor salivary gland called as von Ebner. Now we will see what this von Ebner are. So these are minor salivary gland. They are seen in the posterior lingual. They are seen in the posterior lingual area. They are seen towards the posterior lingual glands. They are seen on the dorsum of the tongue. Dorsum of the tongue near at the sulcus terminalis. You all know the V-shaped sulcus terminalis separating the anterior 2/3 and the posterior 1/3, along with the circumvallate papillae. They are 8 to 10 in number, and they have this serous secretion. They wash through the papilla and reach the taste buds. And what are their functions? They have digestive and protective functions. And they have something called as lingual lipase. What is this lingual lipase? They are nothing but they are secretory enzyme from these lingual glands, and they have lipolytic activity. Lipolytes means your fat cells, means your adipocytes. So they have the ability to dissolve this lipocytes. So they have this lingual lipase have a acidic pH similar to that in the stomach. So what is their function? They increase the efficiency of this pancreatic lipase. The pancreatic lipase are seen in the GIT tract, and they have this role for this lipolytic activity. So similar thing occurs in the mouth also by means of this lingual lipase enzyme. And this lingual lipase have a major role in the newborns, as the pancreatic lipase are not fully developed in these newborns. So they take up the activity of this lipolytic in newborns. Now, just a gist of the nature of secretion of all these glands. The major glands, as you know, the parotid, submandibular, and sublingual. The parotid is exclusively serous in nature. The submandibular is mixed. That is, it has more of serous than the mucus. It is both serous and mucus, but the secretions are more serous than the mucinous in nature. The sublingual gland is also a mixed gland, but their secretions are more mucinous than serous. Mucoserous, but more mucinous than the serous one. The minor salivary glands are mucinous in nature or mucus in nature, except for the lingual glands. That is the von Ebner gland, which is serous in nature. That is only minor salivary gland that has serous secretion. Now coming to the development of salivary glands. How do they arise from? Salivary gland, as you all know, they arise from the ectoderm. First, they form as, means the epithelial cells, they form as buds. As you see in the picture, we have drawn it as buds. The small buds are there. From the bud, the cord formation, the narrow elongation is there, and there will be some clefting will be there, and a lumen formation is there. And the small dotted cells are the mesenchymal cells, and there will be an epithelial mesenchymal interactions, and there will be branching morphogenesis. Can you see that? There is a bifurcation here of these epithelial cells. These are called as branching morphogenesis, means the formation of hollow tubular structures, so that the salivary glands, you all know, they have a lumen inside for the saliva to come. So the luminal formation happens, and that will be seen towards the terminal buds. And finally, once this lumen and everything is formed, there is the formation of the functional units or the secretory units. The secretory units are two types. We have two types of cells there. One is the acinar cells, okay? The acinar cells, and the other one is the ductal cells. Two types of cells will be there in the secretory unit. Inert secretory unit is the acinar cells. And the outer secretory unit will be your ductal cells, mostly the intercalated duct, which we will deal in larger sections later. And along with that, we have something called as the myoepithelial cells. So from this formation of a lumen, how does this enlarge into lobules? As you all know, salivary glands are seen as lobes and lobules. So the epithelial components increase in size. As you can see in this picture, they form into lumens and cords, and you have the secretory unit with the ductal cells, and the connective tissue in between the epithelium diminishes. And this connective tissue will remain around the secretory end part and the ductal cells. Okay, and the thicker portions of the connective tissues forms septa, or the connective tissue septa, as you can see in this picture, that divide the gland into lobes and lobule, smaller lobes and larger lobules. So that is the nature or the structure of a salivary gland, which is lobular or glandular in nature, just like a bunch of grapes. So now coming to the ductal system. So we are, as you all know, that saliva has a salivary structure. Salivary gland has a structure that is made up of a ductal system and a secretory unit. So we will come to this ductal system. There are 3 types of ducts there, depending upon the size. Okay, size, there are 3 types. The main duct is called as the excretory duct, that opens into the oral cavity. As you can see in this picture, the bigger duct, which has a very larger diameter, luminal diameter, that opens into the oral cavity. They are located in between the lobes. So they are called as the interlobular ducts, and they will be seen in the interlobular connective tissue. The smaller one, the next smaller one from the excretory duct, as you can see in this picture, they have a smaller dimensions of the lumen. They are called as a striated duct. They are seen within the lobules, so they are called as the intralobular ductal component. They form the major part of this ductal system. And finally, the smaller ones. Can you see the smaller one? The luminal diameter is again coming down. So these are called as the intercalated duct. They connect the secretory end. Can you see the bunch of grapes like that? That is the secretory unit. They connect the secretory end with the striated duct. So these are called as the intercalated duct. And finally, there are something called as intercellular canaliculi, the smaller tubules, very narrow tubules, okay, thread-like structures. They are nothing but extensions of the lumen between the adjacent secretory cells. So these are the secretory unit. They have secretory cells, and from the secretory cells, the lumen starts. So the extensions of lumen between these adjacent secretory cells are called as intercellular canaliculi, which connects with the intercalated duct. So this is how the ductal system occurs. And coming to the detailed portion of this duct, they progressively increase in diameter from the intercalated to the striated to the excretory duct. Okay, and the intercalated ones are closest to the secretory end part or the secretory acinar cells. The striated, as I told you, they are seen within the lobule. So they are called as the intralobular duct. They are seen between the intercalated and the excretory duct. They play a major role in the modification of saliva, which I'll tell you later. And the excretory duct opens into the oral cavity. So this is how the ductal system works in a salivary gland. Now coming to the secretory units. Okay, we have 2 types of cell. One is the serous acinar cell. The other one is the mucous acinar cells. The serous acinar cells, okay, each acini is spherical in shape, and they will be the serous acinar. They consist of 8 to 12 cells. They surround a central lumen. As you can see in this picture, the arrow shows a small lumen, okay, narrow lumen, and there are some amount of 8 to 12 cells are there. Serous cells are there. So this completely forms a serous acini. So the serous acini as such has 8 to 12 serous cells, and they have a central round lumen, narrow lumen. They produce proteins and glycoproteins, And this serous protein have N-linked, okay, nitrogen-base linked oligosaccharide side chains. The protein from this serous secretions has. Coming to the mucous acini, that is totally different from your serous cells. The mucous acini contain about 10 to 12 mucous cells, about 10 to 12 mucous cells. They are tubular in nature, and their cells surround a very large lumen. As you can see in this picture, the arrow points about 10 to 12 mucous cells are there, and they are seen in a larger lumen, and they are tubular in nature. They are not spherical like the serous cells. They have more tubular shape. They produce more of mucins, which have a glycoprotein that is O-linked glycoproteins. The function is mainly lubrication, and they form barrier on the surfaces. So coming to the detailed explanation of each cell, the serous cell, okay? The serous cell is pyramidal in nature. As you can see from this picture, pyramidal means they have a broad base and a narrow apex. The base is broader than the apex. The narrow apex forms the a part of the lumen at the secretory end. They connects with the lumen. Okay, the apical portion of the cell will connect with the lumen of the salivary gland. I told you the lumen that connects the intercellular canaliculi and then the intercalated duct. So the intercellular canaliculi increases the size of the luminal surface. So here is the lumen. The topmost portion will have the luminal surface, and they have intercellular canaliculi that increases the luminal surface. This is the nucleus, the more purple colored one. They are spherical and in size, and they are towards the basal portion. And the apical portion will have zymogen granules. So that is the structure of a serous cell. Now coming to the mucous cell. Mucous cell is totally different. It has accumulation of mucins, okay, at the apical part. Can you see the accumulation of mucins over here? So this mucus will appear unstained in hematoxyphilic and eosinophilic stained section, and they give an empty appearance. Actually, they are pink in nature, pink in color. And once you stain it with hematoxin and eosin during the processing, tissue processing, when you put in xylene, the clearing agents and all, the mucins get dissolved, okay? And they have they give an empty appearance of the cell. So the nucleus, because of this huge accumulation of mucin, the nucleus is compressed. Can you see the compressed tubular nature of the nucleus? So they will be flattened at the basal end. That is why you draw a line for the mucous cell. The nucleus will be drawn flat at the basal end of the mucous cells. They are elliptical in shape. The nucleus is elliptical in shape. So that is the structure of a mucous cell. Now, there is one more thing called as serous demiliones. So you have heard about this. They are seen, where do you get the serous demiliones? These are seen in mixed salivary gland. Okay. So mixed salivary gland means mostly in your submandibular gland as well as the sublingual gland. And what is this all about, this demiliones? The other name for this is demiliones of Vanosy. Vanosy is named after the scientist. And what are these? These are mucous terminal portions. Okay. The mucous terminal portions are capped by the demiliones of serous acini. Means you can see, as you see the arrow here, the arrow points out to the serous demiliones. The serous cells are capped in the mucous acini. Okay, can you see the mucous acini? I'm showing the arrow pointed ones. This is the mucous acini, which has a nucleus, flattened nucleus at the base, elliptical shaped and larger dimension of the lumen, and the serous acini is capping over the mucous acini. So this is called as the demiliones of Vanosy. This is seen in mixed salivary gland. And one more cells, there's a part of the secretory unit. So you have heard about the serous cells, the mucous cells, the both together, serous demiliones. And finally, one more cell in the salivary gland, that is the myoepithelial cells. Now, what are these? As the name mentions, myo means some form of contraction is there, muscle nature is there. So these are nothing but the contractile cells that are associated with the secretory unit and the intercalated ductal cells. So as you can see in this picture, This is the secretory unit. The pink colored large ball-like structure is the secretory unit. Mostly it can be a serous or mucinous in nature. Can you see some stellate-shaped or basket-shaped cells that are attached to this acinar cells? These are called as the myoepithelial cells, okay? And they are seen adjacent to the intercalated ducts and the secretory unit. They are now where do see this myoepithelial cell? They are seen between the basal lamina and the secretory cell. The outer layer of the myoepithelial cell is the basal lamina. Okay, the basal lamina that separates the epithelium from the connective tissue, right? So these are the below that you will find the connective tissue or the connective tissue septa there. So these are the basal lamina. Between the basal lamina and the secretory end, you will find the myoepithelial cell. They are also derived from an epithelium. They are also epithelium-derived structure. Now, what does it do? It helps in by contraction, they expel the saliva from the secretory unit into the ductal system and further. So, they help in the expulsion of the saliva. They widen the ductal system. Okay, so that is the function of a myoepithelial cell. Now, how does you see in a hematoxyphilic and eosin section? So, as you see here, these are the mucous cells. The arrow points towards the darker colored, the hematoxyphilic colored cells. Those are the myoepithelial cells. As you can see, they are stellate or fusiform shaped or basket shaped cells. That is how you saw it in the other diagram. The basket shaped, stellate, star shaped or fusiform shaped cell. They contain active filaments and myosin filaments that help in the contraction and help in the expulsion of the saliva. So that finishes the cells of the acinar salivary gland or the secretory part. Now moving to the cells in the ductal system. That is the cells of the intercalated duct, the striated duct, and how do you see the cells in the excretory duct? Sorry. So the intercalated duct, okay, they are the first passage of the primary saliva from the secretory end. Few cells of the duct are very close to the secretory end, and the lumen of the duct is continuous with the lumen of the acini. This you can imagine from the acini into the intercalated duct. So the lumens will get connected from the serous, either serous or mucous acini with the intercalated cell. So as you see in this hematoxyphilic and eosin stained section, the arrows, black arrows point towards the intercalated duct. And those rounded ones are your acini. So the acini and the intercalated cells are seen here. Now we move on to the detailed description of the intercalated duct. So these are nothing but simple cuboidal cells. They are cuboidal in nature. Their myoepithelial cells are located in the base. Here you will find the myoepithelial cells, which I have shown you in the other part of the myoepithelial side. And they have a centrally placed nucleus and they contain secretory granules like lysozyme and lactoferrin. They are not actually seen in the routine histopathological section, and they are a source of undifferentiated mesenchymal cells. They have undifferentiated mesenchymal cells. The function is to replace any damaged cells in the salivary gland. So for any damage or repair that occurs in the salivary gland, it is the interductal cells. They have this undifferentiated that start to proliferate and replaces the older ones with the new ones. So that is a function of intercalated ductal cells. Now we move on to the larger duct. Those are called as a striated duct, as you can see in this hematoxyphilic and eosin HNE section. So they receive the saliva from the intercalated duct. They are the largest portion of the major contributor of the ductal system. They are within the lobules, that is intralobular. The lumen is larger than the intercalated duct and the secretory end. And they are also columnar cells. The intercalated ones are cuboidal in nature. These are columnar, tall columnar cells with centrally placed nucleus. As you can see in this picture, the lighter pink colored are your striated duct. Okay, and you have a wider lumen, and those are the acinar part. The deeper hematoxyphilic part is the acinar part, and the lighter pink or eosinophilic structure are your striated duct, and they have a very large lumen. They are columnar cells with centrally placed nucleus. They also have a basal lamina that encloses the striated duct and the capillary plexus in the connective tissue. So they are also close to the connective tissue. I'll show you a picture, a bigger picture. or of a low power section, where you can see the small hematoxyphilic structures are your acinar part. And the pink color, the arrow, black arrow points towards the striated duct. Okay, the smallest duct, which are seen within the lobule, that is intralobule. So you can see the connective tissue. The white colors ones are the connective tissue septa. So separating the each lobule of the salivary gland, and within the lobule you have this striated duct. And between this lobule, you have larger duct called mentioned as ED in this diagram. That is your excretory duct. So striated duct are within the lobule, intralobular, and the excretory duct are between the lobules or interlobular. The white color ones are your connective tissue septa. And the hematoxyphilic part are your acinar units. Now, moving to the striated ductal cells. As I mentioned, these are columnar cells. So the basal, this is very important. This ductal cell, this striated ductal has some specific structures in their cell. Their cytoplasm has numerous infoldings. As you can see in this picture, the basal part of the cell has numerous infoldings. So these are called as striations. Okay, these can be seen as striations in the sections. Why these striations occur is because of the abundant mitochondria. Can you see the small yellow colored structures, long shaped yellow color structure? Those are the mitochondria. Because of the presence of abundant mitochondria, you will have striations, okay? Striations in the striated duct. That is why the name striated duct. These striations or infoldings will appear radially oriented striations in a H&E section. And what is the most important function? They help in the modification of the saliva by reabsorption of all the electrolytes and water, which I'll tell you later, and secretion of electrolytes. So they modify the saliva that is being secreted. So that is the important function of a striated ductal cell. They also contain substances like helichrine and secretory protein, which helps in endocytosis. Okay. Now, we move on to the bigger duct, the excretory duct. You can see how big the duct is. The bigger lumen is there. There are only 3 excretory ducts for the major salivary glands. So this is one of the excretory duct. This is how you see in H&E section. The smaller topper view is a closer view of this excretory duct, the cross section of the excretory duct. So these are in between the lobules. So they are called as the interlobular or extralobular duct. They are located in the connective tissue septa. They are larger in diameter and they have pseudo-stratified epithelium. As you can see in the picture, there is a pseudo-stratification is there with columnar cells as well as small basal cells. So they have 2 types of cells, the columnar cells as well as small basal cells. And this is called as a pseudo-stratification. But once it reaches the oral cavity, stratified epithelium is seen at the opening. The opening of the duct will have stratified epithelium. The rest of the duct will have pseudo-stratification, and the small white colored portion where the arrow indicates represents the goblet cells in the excretory duct. So this is the picture of the cells as well as the ductal system of a salivary gland. You can see from this right hand portion, you have the myoepithelial cells. Nearer to that, you have the serous acini, and we have the mucous acini here towards the lower portion. And we have striated duct as well as the intercalated duct. This is how you picturize the cells as well as the duct in case of a salivary gland. Now we move on to the formation of saliva. How the most important function of the saliva is to secrete, salivary gland is to secrete saliva. Now, what is the saliva all about? The saliva has a pH of 6.7 to 7.4. The volume of saliva that is secreted is 600 to 1000 ml per day from all the major glands. The parotid saliva means that the serous saliva, they are watery saliva. They are rich in enzymes such as amylase and rich in glycoproteins. Whereas the submandibular saliva, yeah, I told you it is seromucinous. Okay, it has both serous and predominantly serous as well as mucus. So they have thicker saliva. Okay, because of the mucins present there. But coming to the sublingual, which is predominantly mucinous in nature, they are very much viscous in nature because of the predominant mucins that you see in a sublingual gland. And all this forms a mixed or whole saliva in the oral cavity. What do you mean with this whole saliva? The whole saliva will contain not only the fluid, but also desquamated epithelial cells, microorganism, of course, the leukocytes and the gingival trabecular fluid. All together forms a mixed or the whole saliva. Now coming to the composition of the saliva. The resting flow rate of a saliva is 0.2 to 0.4 ml per minute. They have electrolytes like sodium, potassium, chloride, bicarbonate, calcium, magnesium, and iron. And the secretory proteins contains amylase, mucins, cystatin, cystatin, peroxidase, lysozyme, lactoferrin, and statin. You have immunoglobulins, major function antibodies. They have secretory IgA, IgM, and IgG. And they have small organic molecules also, like your glucose, amino acids, urea, uric acids, and lipids. So the functions of saliva, so that is the composition. Now coming to the functions, which I'll deal it later elaborately. Protection, buffering, digestion, taste, antimicrobial action, maintenance of tooth integrity, and tissue repair. So what do you mean by protection? Since they have a watery nature, they help out in washing of all the whatever the substance that is accumulating. They help out to wash out from the oral cavity, especially the microorganism as well as the sugars. They are also lubricant. Mind you, the mucinous has lubricant in nature, so they act as a lubricant, and they also have a glycoprotein content. Now, what is this buffering capacity? They maintain the neutral pH in the oral cavity with the help of all these ions, the negatively charged bicarbonate, the phosphate, the basic proteins, urea and ammonia, all help in buffering nature of this saliva. And the saliva has a digestive function, means they help in the digestion of this amylase. Mainly, they have this enzymes called as amylase and lipase. Amylase acts on the carbohydrate that you have it in the oral cavity, means the bolus of the food when it comes into the oral cavity will have carbohydrate. So your enzymes in the saliva, the salivary enzyme amylase acts on the carbohydrates. That is why we will always ask to chew the food so that they have more action, more of the salivary actions on the food. So amylase, carbohydrate acts on carbohydrate, and lipase acts on the fat foods. The help in the formation of a bolus of the food. So that is a function of digestion portion of the saliva. Next, we have taste function. They help in the solubilizing the food, and they help it. The saliva helps to present it to the taste bud that is seen on the dorsal surface of the tongue. We all know the dorsal surface of the tongue has numerous papillas, and the papillas has taste buds in it. So they help, the saliva help to bring the food towards the taste receptors that is seen in the taste buds. They have antimicrobial functions, okay? Thus, mucins will never allow the colonization of the microbes, okay? And they have lysozyme, lactoferrin, and peroxidase to counteract with this antimicrobes in the oral cavity. And of course, there is secretions of antibodies, that is IgA, the immunoglobulins. They agglutinate for specific microorganism and evade all this microorganism inside the oral cavity. They help in the maintenance of tooth integrity also by supersaturating with calcium, because you all know the enamel and the tooth part contains calcium and phosphate ions. So say supersaturate it with calcium and phosphate ions for the normal structure of this tooth, and they help in the post-eruptive maturation and remineralization of tooth also. So those are the functions of saliva. Now, how does the mechanism of salivary secretion occurs? Okay, so we have proteins, we have electrolytes and water in the saliva. I just pulled out some certain points because it is an elaborate thing. So I just wanted to highlight the important things in the secretion, salivary secretion. Mainly the protein secretion occurs by exocytosis from the secretory portion, from the secretory granules. And there are something called as the innervation of the salivary gland that I will tell in the next few slides. We have the epinephrine and the norepinephrine, the sympathetic and the parasympathetic innervation you all know of. The norepinephrine or the sympathetic, the alpha and the beta adrenergic receptor help in the formation of thick saliva, okay, thicker saliva, more of mucinous in nature. And the parasympathetic, okay, or the cholinergic receptor will help in the formation of a watery saliva. And this receptor stimulation will cause influx of calcium ions and efflux of potassium ions. That is very, very important for the formation of the saliva, the influx of calcium into the lumen and the influx of potassium outside the lumen. Okay, so that maintains the electrolytic balance. And along with that, we have substance-free, cyclic AMP and GMP, which helps in the maintenance of this electrolytes. So that is the small gist of the mechanism of salivary secretion. Now, the other important part, the ducts helps in the modification of the saliva that is secreted by the secretory unit. Okay, mainly this ductal modification occurs in the striated duct. I told you earlier about that. So the striated as well as the excretory duct play an important role in the modification of the saliva. What does they do? The primary saliva that is produced by the secretory acinar units and the intercalated ductal cells, they help in the formation of the saliva that I told you before slide. What does this striated do? They help in the reabsorption of the sodium and the chloride ions, helping in the formation of a hypotonic saliva. And they also secrete potassium and bicarbonate ion. The composition of this saliva will depend on the salivary flow rate. Sometimes there will be high salivary flow rate and sometimes there will be low salivary flow rate depending upon the oral cavity conditions. And these are regulated by autonomic nervous system, both the parasympathetic and the sympathetic innervations. Now, how does this modification occurs? I told you there will be resorption of sodium and the chloride ions causing a hypotonic saliva, and the duct will, this striated duct will secrete the potassium and bicarbonate ions and they push into the lumen. And there will be reabsorption of water also in order to maintain the water and the electrolyte balance in the saliva. And during high salivary flow rates, you will have sodium and chloride concentration at the higher level and the potassium concentration decreases. This will reverse in the case of low flow rate. The sodium and the chloride concentration decreases and the potassium concentration increases. So this is the ductal modification of saliva that occurs in the striated duct. Now we move on to the innervation, the sympathetic and the parasympathetic supply as well as the blood supply for each gland. Now moving on to the parotid gland, the blood supply is from the external carotid artery. As you can see in this picture, the external carotid artery supplies the blood, and the parasympathetic nerve supply for the parotid gland is from the glossopharyngeal nerve. And they have the preganglionic fibers in the aortic ganglion and the postganglionic fibers from the auriculotemporal nerve. Okay, so this is for the parasympathetic innervation of a parotid gland. For sympathetic innervation, all three glands have a common sympathetic innervation, that is the postganglionic fibers from the superior cervical ganglion. The postganglionic fibers from the superior cervical ganglion not only supplies the not only innervates the parotid gland, it innervates the submandibular as well as the sublingual gland. So all three glands have a common sympathetic innervation. Only the parasympathetic differs. So the submandibular gland, again, the blood supply is from the facial and the lingual arteries. As you can see in this picture, facial and the lingual arteries will supply the submandibular gland. And the parasympathetic nerve here is the facial nerve. And the preganglionic fibers synapse in the submandibular ganglion. Okay? And sublingual gland have submental and sublingual arteries supply. And the parasympathetic nerves is the facial nerve. Again, the same facial nerve for the submandibular gland. And the preganglionic fibers synapse in the submandibular ganglion. So this is that is common for both submandibular and sublingual. The innervation is common for submandibular and sublingual gland. So that is the innervation and the blood supply. And coming to the clinical consideration for this salivary glands, what you have to know about is xerostomia or dry mouth. It is a condition where there is a reduced supply of saliva in the oral cavity that leads to dryness of the mouth. That is called as xerostomia. And what is this xerostomia occurs? During radiation therapy, during any cancers and all, if you have mainly in the, especially in squamous cell carcinoma or the oral cancer, we have a radiation therapy that is given to treat the cancer. At that condition, you will damage the salivary gland cells, so there will be decrease in the secretion of saliva. There is one more pathological condition called Sjogren's syndrome that affects your minor salivary gland also. So that you will deal it in third videos class, but you should know what is Sjogren's syndrome. It's an autoimmune disorder that affects your salivary gland. And as you age up, the salivary glands will be filled up with fatty cells than the SNR unit. So these are the clinical considerations for salivary gland. So that finishes my presentation, and lovely talking to you all of you. Thank you so much.